If you were preparing to do nasotracheal suctioning in the hospital setting, you would obtain a suction canister with short tubing from the supply room, a long tubing set, a Yankar, the individual suction catheter kit that is in your complex needs, lubricating gel, tape, non-sterile gloves, an empty water bottle with the label removed, and then you will have saline in this kit. I do not, and so I have a bottle of water that's going to serve as my sterile saline. As you can see, I've taken an empty water bottle and I've secured it down to the table like an airway would be on a patient. Your suction catheter kit, your non-sterile gloves, and either lotion or any kind of lubricant if you cannot find your lubricating packet from your J1 nurse pack. So the first thing you're going to do is you're going to open your suction catheter kit. You are going to remove the sterile gloves, and then you're going to get your packet of lubricating jelly and you're going to open it and you're going to put it on the inside of this. So I've got my lubricating jelly on. Now I'm going to take and put non-sterile glove on my non-dominant hand. I'm going to open my sterile glove packet. I'm going to touch the inside only, the sterile glove. So I have my sterile glove on. I'm going to remove the catheter from my tray. My non-sterile hand, I'm going to open my bottle of sterile normal saline, which I wish that I had loosened ahead of time. And I'm going to put some sterile saline in my tray. And this is all at the bedside table, right over the front of my patient. I'm going to pick up my sterile catheter and I am going to wind it in my hand this off, and connect this to the suction tubing coming from the wall. Test it, make sure that it's working. And then I am going to put my catheter in the lubricating, and then I'm going to enter my patient's airway. I'm going to advance the catheter until the patient begins to cough or I meet resistance. And when that occurs, I'm going to apply my thumb while I suction. And then I'm going to make sure that the oxygen saturation stays at 95 to 100%. Give the patient a chance to catch their breath. And if they need it again, and I need additional lubrication, I'll go back and get more. If it's thick secretions, I can put it in my sterile saline, clear out my tubing, add more lubrication, and then come back and do it again. Enter the airway, gonna advance the catheter till I meet resistance where the patient begins to cough. And then I'm going to apply suction. And I can go down one more time after I've allowed them to take some breaths and rest before I attempt to do it again.